SM or the Marshall Islands.
Right, and so I guess, if we get a chance to follow up on this, my main question would be, why didn't the governor's office tell anybody about this? Mm-hmm. You know what I mean? 7:21, we're going to switch gears. We got Tom from the Salvation Army coming up to talk about the great increase and the great need the people of Guam are in right now. But 7:21, just want to get her on ahead of the community testing that's going on in Estumbo tomorrow from the Department of Public Health and Social Services, Linda Denorcey. Good morning, Linda.
Good morning.
So we had heard, and maybe you can just kind of verify, you said it, so they're out there canvassing, and now people with the COVID-19 symptoms are meeting any of the criteria for testing, or they're going to get a coupon.
Or a pass.
A pass.
A pass.
Yeah, okay.
Yeah, a pass.
So I guess just take us back to when your staff is out there canvassing, maybe the process from, knock on the door to getting the pass.
Absolutely. We have in our Department of Public Health two units. One is the surveillance unit that's comprised of all our nurses, and the other unit is our containment unit. And those are the individuals that are heavily involved. They're CDC workers to contain the spread of the infection. And so what they're doing is they're teaming up along with our mayor on all the different homes throughout the area that we're targeting, specifically the Sagan Linahasan and the Lower Estumbo in Dedido residents. And so they would go out and they have their assessment form. And again, that assessment form has a series of questions of the different types of symptoms that the patient may have. For example, do they have a fever, or do they have any chills, or do they have any muscle aches, runny nose, sore throat, cough, shortness of breath, any diarrhea, vomiting, and so forth. Also, we are looking at another unique symptom, which is the sense of taste or smell being lost, or even appetite, and some discoloration on their fingers or toes. While they're doing that assessment, we're also looking at other pre-existing medical conditions, such as chronic lung disease, emphysema, asthma, or COPD. That's, of course, the pulmonary diseases. Diabetes, of course, as you know, cardiovascular, and lung disease, liver disease, end-stage renal disease, hepatitis, and if they're smokers or they were current smokers. In line with that, we also are assessing homes that have multi-generation. In other words, they have grandma, grandpa living in the homes all together. But our main focus here, Sabrina and Chris, is really the symptoms, because we're looking at another approach, which is elimination. Okay, we want to expand testing criteria, as I mentioned, to all these other clinics, right, that have been doing all the screening and the testing. In the past, we focused our energy on testing those patients that are hospitalized with COVID with COVID symptoms. We also focus our energy on people with chronic conditions that have symptoms of COVID-19, and also healthcare workers that may have COVID-19 symptoms. But now, and we told them in the past, okay, let's have you, if you have mild cases, just stay home. Now we want to move forward in our posture of eliminating this virus, and the only way we're going to do it is to expand our testing criteria for the mild cases of those that weren't able to be hospitalized, or they didn't meet that criteria to be hospitalized, or be even at SNF or in any of our hospitals throughout the island. And the aspect of expanding testing criteria is not only applicable to the private and the public health facilities, but also the other prong approach that we have is active case finding. Where do we find these individuals that really they don't have any transportation, they don't have access to care because maybe they just don't have any insurance, or they have cultural barriers to care? So we look at these people that are very vulnerable and they live in these isolated, remote areas, with the fact that they don't present themselves to the clinics. And so we've been doing this, Sabrina and Chris, many years, going out. It's called our extended outreach clinics, where instead of them coming to our doctors or our clinics, we go out and find them and reach out to them. And so this has been since the ARA grant, and we never stopped it because we felt it had a great impact. And so what we're doing as I speak is a pilot testing, and we're reaching out to these individuals. And again, we've canvassed yesterday. We're going to do again when I say combat, I'm not only saying that, I'm saying do a complete assessment of the individuals in the home. And of course, they're donning their PPE for protection as we journey through. And we just want to make certain that these pockets of infection, that if they are occurring because they don't come to the clinic or they don't go to the hospital, that we find these people so that we can completely try to eliminate the further transmission or the further community spread of the infection. And when we do find a positive case, we also would like to take it another notch, such that those that are living in the household, we can also test those household members and the close contacts and find out if, including those that are asymptomatic, to find out if they are also infected.
Mm-hmm. I wanted to ask about the Saginaw Lananza and Estumbo area. Was it selected because it's linked to other possible cases, or just because it's a vulnerable population and they don't have the means to or access to health care?
Right. We when we sat down, we assessed every avenue or opportunity. We are looking really at high-risk individuals, not necessarily because we've already reached out to those cases. We've done our household contact and our surveillance and our close contacts with those that have already been identified to be positive. As you know, Guerrero is a very densely populated village, and so we know that the ethnic distribution of that area is really diverse. So it's not just Chamorros. We also have FSM. We have Filipinos. We have practically every ethnic representation. And so what we want to do is we want to hit those areas that, as you mentioned, that are vulnerable, high risk, social determinants of health, that poverty could come into play, educational, they don't have all those criteria that we want to determine that they will be the best test at this point in time in terms of targeting them. Does that answer your question, Sabrina?
Sure. For the Saginaw Lananza area, what is the ethnic breakdown? Is it mostly Chamorros?
There are Chamorros there, and I believe there are FSM, and I believe that area is the Dollar Down area.
Yeah, Dollar Homes. Mm-hmm.
Yeah, Dollar Homes for their agricultural. Yeah, so specifically, I believe a lot of them are Chamorros. Majority are Chamorros because of the land trust, right?
Yeah.
Linda, and those houses are really close together.
Right.
Yes, exactly. Very close. I mean, I have the opportunity to visit them because we did a walkthrough yesterday with all our collaborating partners, federal, local, and private. And the setup will be, as you know, in the Estumbo Gym. As I was journeying through, I asked my staff, take me to the area of target, and they took me all around, and I looked at their conditions, and I said, wow, these houses are really, really close by. And you're right. This is really a great population to have this pilot project. And again, the setup is where they will come into the Estumbo Gym. That's where it's going to be held from 9 to 12. We're getting the two other schools right adjacent to the Estumbo Gym, so we can really do great trafficking. Of course, the National Guard will assist us in that, and we also have the Guam Police and the Guam Fire Department, and we will have a physician there just in the event anyone that presents with illness that we can take care of them should an emergency arise. We also have...
Linda, can I just cut in real quick and add a comment here from our Facebook audience? Asymptomatic people don't show signs of illness. They won't have any of the symptoms, but they carry the virus and can spread it. Yes. These are the people that need to be found and told to stay home. It's not the people that are sick already. What are we doing to test these... because I'm assuming if you're asymptomatic, you don't have the symptoms, but you're not meeting any of the criteria for this pilot testing. So
if they're asymptomatic and they present today, we will tell them to go ahead and exit out. However, bear in mind that since we started, people have been going to the clinics, the private clinics and the community health centers. We also were able to test those that are also asymptomatic, but we don't do the testing here on Guam. We send them off island through DLS because we wanted to focus again on the high priority groups. So that's to say that we also have been testing them as we journey through. However, those test results went off island. And when we get them back, we include it in our data.
Mm-hmm.
So that's to answer your question. Now, yes, you're right. They are asymptomatic, and that's the reason why we want to capture those that have symptoms, because the incubation period of this virus is 2 days to 14 days. And if anyone in their household or living in that have close contacts with them, we'll eventually find them. And like I said earlier, they will obviously be, this is another step notch where we can also test them for asymptomatic symptoms once we find the COVID positive.
What did you make of, we had Dr. Shea on, and he was saying that if the public health staff are going out and going into these homes and doing these screenings and talking with people, why don't they just swab these people while they're there at the house?
Yes, that was already brought up with ours, and we're going to do that for those patients that, of course, are homebound. Let's say they're bedridden. We have already talked about that. Those that can't make it because of their conditions. Again, that's already in discussion, and we are going to plan. We are already at that point where we can also do that.
So,
that is correct.
But I think what he meant was, well, if you're going to do that for the homebound, why aren't you just doing it for everybody?
Because what we want to do is, again, every household, sometimes we have no privilege to go in. Sometimes they're not home when we come around. They may be at, elsewhere. Of course, some people do practice social distancing, some don't. This is just like what we encountered during the dengue outbreak. We went out. Those people that were not there for whatever reason will leave messages on their door. There are times where we can't find individuals, and that is the reason why we want to do this drive-through and walk-through, because the walk-through for those who have no transportation, the drive-through, if we miss them somehow when we go out, that's another opportunity.
Linda,
we want to not miss any opportunity for this study.
If you don't have a pass, you can't get tested Saturday?
Well, that's a very good question. That's like an unknown at this point in time, because we don't know if we're going to get all our 100 people, that even if we give them passes, they may come up or not. That always happens. Just like when you schedule an appointment, we say to the patient, please come for your medical appointment. Don't miss it, because, it's going to take time for you to get another appointment. Mm. We always have patients that have what we call appointment failures. At the community centers, it's at least 20% appointment failures. That's beyond our control. So let's say we have 50 people that already come and they have their passes. And yet, okay, maybe there may be other cars that come in and they heard about it from their friends or through social media. And we're towards the end, and we feel that we will assess them. No doubt about it. We will assess them. And if we have that opportunity to go ahead and of course they present themselves with mild symptoms, we will take them till we reach our quota. Now, if we surpass it, we will give them an information, a flyer that has all the contact places to go to, whether it's northern, southern, central, especially these individuals are living in these remote areas. However, that's not to say they can't go right now. They can go today. They can go today. They can even go tomorrow, and they can even go to any of our clinics that are open, and they're open from Monday through Saturday from 8 o'clock to 6 o'clock p.m.
Linda, so if
followed up as well.
Right. If we go to these clinics right now, we listen to what the public health director says. When I show up, am I going to get tested, or do I have to have the symptoms and meet the criteria that you're applying for the pilot program?
Yeah, we will expand the testing criteria for those that are patients testing with illnesses, mild illnesses, like I mentioned earlier.
Mm-hmm. Right. So it's the same criteria as for the pilot program. Okay. Correct. Okay. Because people are thinking, Linda, that they're just like, like take me for example. I'm walking, I'm talking, I'm here at work, la-di-da-di, we like to party. Yeah. But I want to go get tested. That I'm going to get turned away.
Well, I don't like to say you're going to get turned away. We don't like to turn anyone away, and because we're federally qualified health centers, we don't turn people away.
So what are we going to say, Linda? We're not going to say turn away.
No, we're going to say that we will contact you, and of course the nurse will make the assessment, Chris, and we'll assess if you're at risk. Okay, so. Again, it's going to be dependent upon who you're in contact with, who possible cases you've been around. We'll do all that assessment. and have you traveled, and all that information will be definitely taken. So we at the health center, even if you have nothing to contribute to pay, we'll take you regardless of your ability to pay.
And it's free, right?
Yeah. No, you know what? That's the reason why we have these programs. If they qualify for a sliding fee discount and they meet their income eligibility based on family size and income, they can get different percentages of discounts. So 100% is you just pay like $10 and that's it. But if you can't pay up front the $10, we give you a payment plan. So it makes it convenient for you to, collect.
So
can you just clarify that?
Yeah, Linda, because we had heard from different doctors on the physicians advisory group that the testing was completely free, and that we were told to say
free
that
for the vulnerable population.
Okay.
Yeah, you have to watch how you utilize your words, okay? Because when you say Medicaid, MIP, they're fully covered, okay? When you say uninsured, of course, we base it if they come to the health center, if they have they meet the 100% sliding fee discount. That means that they only pay a minimal fee. However, the federal government does allow us that if they cannot come up with a minimal fee, then we can ask them to, again, either have a paper that says, okay, I only owe you $10. How long would it take for me to collect $10, like that? Or they have no fee, no income at all. They'll fill in a form called a self-declaration form that they have no income. And so we base it upon their face of giving us that information. And again, if it is covered, yes. If it's covered and paid by the insurance, yes, it is covered and you don't pay out of pocket. Okay?
So for the people that are in Estumbo that you're giving out the passes to, they also have to pay?
No, this one will be covered by the government.
Okay. Yeah.
Okay.
So you mentioned earlier
a few more on the different areas. So we're hoping that we can get all of them passed out. So and again, like I said, we don't know the volume, how many will come, even if we distribute those, and we'll play it by ear at the time when we're there, so we can make certain that again, we're hoping at least 50 people show up, but we're happy if 100. Right. And if more show up, then again, we can also revert them, and we're going to get their names, and then we will refer them to the community health centers, or in this particular case, the community health centers. Okay.
We've heard a lot over the last couple of days about how we have built up our testing capacity, how we are able to test, or should be able to test about 258. At least that's the goal a day. And so why is the test sample just at 100?
It's a sample size, okay? And again, we're also wanting to do this sample size because remember, when you test 100 people, and let's say all 100 test positive, there's that possibility that there are household members that could also be positive. So for one infection, you're looking at 2.6 of other people being infected. So right there, you already double, right? You already have over 200 plus. And again, that's also dependent upon that individual infecting other people, other household members, other contacts, close contacts, whether they're related to them or not. And so that is the reason why we're putting that size in.
Right, but Linda, I think it was the governor had said in one of the press conferences that we're going to be testing 258 people a day starting this week, but it's already Friday, so where are we with that?
Yes, we're going to be doing that, and again, like just yesterday late afternoon, we just received another 400 test kits. And so, but
we're still testing 40 people a day when the governor said that this week we were going to test 258 people a day, but it's already Friday.
You're just counting only the people that are seen at the test that is being done on this coming Saturday. But remember, we're also testing at clinics, whether they're public health clinics. We're also testing at the private clinics and also the hospital, and off-island testing through DLS. And so just to give you a picture, these are all the entities that we're doing, and we also have the National Guard also doing their testing as well. And so we're trying to put all our resources together so that we get all the available resources coming from ELS, coming from GRMC, coming from GMH, coming from our laboratory, and putting it all together so that it matches that amount.
So are you saying, Linda, that if we add up all those things, we are testing 258 people a day, or no?
We're starting, and we're going to continue. And again, it's all going to be dependent upon how many people show up.
Right.
So our goal is to try and test many more people as we can as we journey through.
Okay.
For Saturday, I wanted to get back into Saturday. Are you going to have the results ready that night, or how long is it going to take to get the results?
Yeah, that's a very good question. I'm assured that we have our PCR testing, the ABI 7500. We will base it upon how many show up, as I mentioned, because we have that capability of also sending it off island, and we also have that capability of running it at our clinic here. So we also want to put some reserves in the event that we do have over the weekend. As you know, that's a time when a lot of people come into the hospital emergency rooms. So it's going to be dependent how many we collect, and I can't tell you exactly how many will come. So it'll be contingent upon that. If we looked at 100, we have the capacity to test them here, and we also have the capacity to test them off island. Maybe we'll split it in half. Again, it would be also dependent upon the illness that we find, and again, our physician group will make that determination as far as which one will be prioritized in that group that we collect.
Okay, but I would think that if you guys set a sample size of 100, then you would know if you'd get the results the same day.
Yeah,
and figure it.
we could do that, not a problem. Again, I want to put some reserves because we don't know what's going to happen over the weekend. If a surge of patients are going to come in, the hospital has, although they have their testing now, we always, sometimes we rerun tests. If the physicians feel that it needs to be done through the ABI 7500, we will run the test. Even though they did it there, we'll run it again. If there's that feeling that the providers feel confident that sometimes they are ready to be discharged, so they're assuring that 2 negative results occur before they discharge them. So, these are things that are taken into consideration.
Yeah, and Linda, again, I feel like we have come out this week and we said that we're casting a wider net. We're going to do this, we're going to test, but just not seeing the volume of tests that we were told we were going to see. Again,
this is a pilot test, and we are still testing as we speak.
Okay.
We will eventually get there, and again, if I get under positive cases, we will test in the homes.
Okay.
And again, if anybody is in the home front and contact, so we can double that up right away.
How many test kits do we have currently in our inventory?
Okay, in our inventory right now as we speak, we have a total, okay, I'm gonna gather that in a minute here. We have right now, as I mentioned, 400 arrived.